And welcome to today's segment of The Power of Money. As always, I'm your host, Michelle Graves, affectionately known throughout the United States as the Money Lady, and I bring to you over 30 years of expertise in the area of money and finances and real estate and insurance and just about everything. But I am also expanding my scope to include health and wellness. And this last year, I've had experts on talking about everything from water to eating properly to nutrition and exercise to get, hey, that's the key, work that fat. And today is no exception. We'll be dealing with today a very sensitive topic. I treaded lightly on the subject over the years and didn't quite have the right kind of person to interview on this subject. But it is a subject that has to be talked about. Even when I introduced the whole area of Alzheimer several years ago and began to talk about Alzheimer's disease and how it was devastating families, and it's now officially an epidemic. But today's subject matter, and just have a seat because you're going to be talking to one of the top authorities on this subject matter, and fascinating. We're going to be talking about mental illness and seniors. Did you hear me? Mental illness and seniors. And I'm just going to say up front that I know why nobody wants to talk about mental illness, because it just makes you feel icky and powerless. But I say to you, and I stand before you today as a highly educated woman who has friends who are mentally challenged, and they don't even know it. We're looking at them because they're socially adept. But the fear I have is as they continue to age, their ability to manage this is going to completely collapse, and their families have formed a hedge around them because they don't want to deal with this, and they don't know how to deal with this. Is this you? Am I talking to somebody out there that can relate? So today we will be talking about mental illness and the aging population, and I have as my guest Miss Bass. How are you?
I'm fine. Thank you for having me.
Oh, it is my pleasure. As I shared with you, I've been very, very delicate about this subject. But give us a little bit of background about who you are and how you got involved in this. You're a gorgeous woman. My goodness gracious.
You're kind. Thank you very much.
Yes.
Well, Michelle, I've been fortunate enough that I've been in the field of nursing, mainly in the Dayton area, for the past 25 years. Years ago, you know, we had no other alternative but to send those folks in long-term care, meaning nursing homes, assisted livings, to a floor at a med-surg hospital, to the psychiatric floor. And kind of there, they were in a mixed population. They were among a 28-year-old male who's very strong with chemical addiction, with alcoholism, with true mental health diagnoses, maybe such as schizophrenia. And really, that was truly no place for an 80-year-old grandma or grandpa. But that was our only option. So I was fortunate enough to work for a competitor in the Dayton market, and really, I think, found my niche with my career. I started as a nurse liaison for them. I'd go on site doing assessments. And I have to say, I've since then transferred to the Cincinnati market. I've been with our company for soon to be a year, October 5th.
Okay.
I am director of marketing, but more importantly, I'm the nurse liaison for them. So when we have a need out in the community or get a call or a referral, I am the one that goes on site and does the assessment to determine if those folks meet criteria to come in for inpatient. or what is the best source of treatment for those folks. You know, maybe it's our outpatient program, and depending on their age, maybe they are more appropriate for our adult unit versus our geriatric unit. So we
Okay.
have all three of those programs at Blueridge VISTA, which is the hospital that I represent.
So tell me, because that's a lot.
It
You've
is a lot.
you've shared a lot, and I'm like, how does one make a determination as to whether a person is mentally, and I want to use the appropriate term, is it mentally challenged? Is that the term, or is it mental illness?
Mental illness or mental health problems, behavioral problems. We hear many terms.
Okay.
None is right, none is wrong.
Okay.
So if in long-term care, we like to say if you're spending anywhere from an hour to 2 hours just with the one patient, that patient is needing your attention, it's probably a good time to take a look at them to see if they could benefit from coming in, to maybe having meds adjusted, maybe participating in group or individual therapies, any of those things. If mom or dad or grandma or grandpa or whoever is at home, and you think things are just not quite right, maybe they hoard, or maybe they're hallucinating, maybe they're delusional, maybe they're recalling things that didn't happen or aren't true. Any of those are reasons to give us a call. Once that call is made or you recognize that you may need some help, you simply can call our intake department or me directly. I can come wherever the need is, wherever that patient is. I go to homes, I go to jails, I go to homeless shelters. We partnered for years when I worked with the competitor in the Dayton market with the homeless shelter over on Apple Street.
Okay.
And we're able to help quite a few wonderful people. And as you said, you know, as people age, and if they do have mental illness, they just kind of lose that ability to manage truly what we take for granted. You know, our day-to-day living, balancing a checkbook, paying our bills, socializing. So as that disease process takes effect, they become more and more isolative.
Okay.
So that in itself is a good reason to give us a call. But as you said, the families, if they're lucky enough to still have family relationships, because so many of these folks kind of, the family cuts ties or they cut ties, sometimes unintentionally, but nonetheless, so they are left with no one.
Okay.
So
Now, does that isolation accelerate or intensify the illness?
I would say, yes. I would say so.
Okay.
Yeah.
So they still need that social interaction,
Sure.
even though they're a little bit off kilter.
Yes. Yes.
So may I just ask, how does one, as a, whatever the term normal, I think I'm normal, I guess, there may be those that dispute it. Anyway, how does a normal person reach out and suggest that they need help?
That sometimes is a very difficult conversation because we certainly don't want to offend someone.
No, you don't.
Or hurt their feelings in any
Right.
way. And that's a very delicate conversation that I've had with many family members. Sometimes family, they don't want to have that conversation. They'll do anything to avoid that, but that certainly is very important. That's the first step in getting that patient the help that they truly need.
So why do you think the families are resistant, do you think?
I just think they either don't want to, you know, harm that relationship any further than what they think it might do to the relationship.
Okay.
They're afraid of the unknown.
Okay.
They don't know what's going to happen after that. They
Okay.
don't know how that person's going to respond. And they don't know truly, because of the stigma that's been associated with mental health, uh, what is going to happen after that conversation takes place. You know, what are the steps following that? So I think 90% of the time it's out of fear.
Okay, so they're reluctant to engage in substantive dialogue with a professional such as yourself because it might lead to unintended consequences, perhaps.
Perhaps.
You know, perhaps. That's the fear and the thinking because they don't know. I mean, you're here today, but I have no clue. I do know that I've had enough interface and interaction to know that it is critical. My sister retired from the mental health industry a couple of years ago, and during her involvement, she was mainly involved with youth.
Okay.
And there were some things that I saw that I was like, I can't believe this.
Right.
And she said, Michelle, you don't ever want the brain to get sick.
Right.
She said, whatever you do, hold on to your sanity.
Right.
Because it's very hard to bring people back when they cross that bridge.
Right.
Is that
but it's not impossible.
It's not impossible.
And those are some of the things, you know, I wanted to talk about.
Okay.
Many mental illnesses can be managed successfully, and it's just a matter of getting more facilities or getting the word out that there are such facilities such as Blueridge VISTA.
Okay.
You know, we have 21 beds of geriatric mental health.
Now what does that mean when you say that?
We are an inpatient acute care hospital. We are a mental health hospital.
Okay.
We try not to say the word psychiatric.
Okay, well then that's fine.
Because certainly there are those stigmas associated with psychiatric services, psychiatry, psychiatrist. No one wants anybody to know that they see a psychiatrist or that they talk
Although
about that.
Although if you knew the truth, everybody does. Anyway.
Well, we're very blessed to have two of the best psychiatrists in the Cincinnati market. Am I allowed to mention their names?
Yeah.
Dr. Ravender Mann and then, of course, Dr. Canaria, both fabulous psychiatrists. We also have Dr. Fleites and Dr. Notikov of the Midwest Hospitalist Group for our internal med docs. So not only are our patients seen by a psychiatrist daily, they're also seen by a medical doctor every day.
Okay.
So we manage both the mind and the body. Ours is a very holistic approach to healing.
Now what does that mean?
That means we have a multidisciplinary team that converses and consults regarding each patient every day. So that patient is getting a total benefit of healing, so to speak. We like to think that our hospital is set apart from all the competitors in the area. If you haven't toured, we would love to tour you. It's a beautiful facility. It's very Zen, spa-like, I like to think.
I like that. That's nice. That's very comforting. What about aromatherapy? We
have aromatherapy. We have music therapy. We are looking into pet therapy very soon for those folks that are interested in that. We just are very fortunate to be part of a new building and a new concept. So this is the second hospital that this company has opened.
Okay.
We opened one back May 21st, 2015 in the Cleveland market.
Okay.
It reached its fullest capacity of 30 beds with
How
a 30
quickly?
bed census. Actually by that first year anniversary.
You were full?
Yes.
Now do they stay permanently or is it, do you have benchmarks as to when they can leave? Because
we do.
Okay.
We have what's called an average length of stay, which on the average for our seniors is about a week to 14 days.
Oh, really?
There are some outliers. There are some that require a little bit longer treatment or help, and some that not so much. You know, maybe we've done some minor med adjusting and we feel they're back on the right path and they're ready to go back to wherever home is.
Okay.
And then of course those outliers that are greater, maybe a new behavior's developed that wasn't initially something we brought them in for treatment for. You know, there's just all kinds of, each person is so individualized, and it truly is case by case.
So may I ask you this question? When you look into so many of the, there was a policy change. I remember in Cincinnati, Ohio, there was Longview Hospital. It was a psychiatric hospital on the outlying areas of Cincinnati. And I just remember that people that couldn't cope they lived there. It wasn't anything about counseling to translate you back into the world. And of course, all that's been shut down. Longview's long ago closed, completely different company buildings, etc. But I oftentimes remember that that whole stigma of Longview Hospital for years and years and years for people that were not functioning. Have the definitions changed since they closed? The state doesn't do any of that anymore, do they?
No.
None of it.
I would like to think mental health has came a long way since those days. We're so fortunate that places like Blueridge VISTA are out there and accessible for the public, for whoever it is that needs the help. It's simply getting the word out to let folks know that those places do exist, and we are ready and willing to help whoever it is that has those needs.
Okay.
Right now we have our 21-bed geriatric unit open,
Okay.
and that is for patients that are 55 and older.
Okay.
Here within the next week or so, we anticipate opening our 23-bed adult unit.
Okay.
And that will encompass the age group of 18 to 54.
Okay.
And then we'll also have an outpatient program. And what that means is, Michelle, we will have 3 hours of structured programming. We'll have transportation, so if you're in that Blueridge VISTA vicinity or 10 to 15 mile radius of our
that's
hospital,
very large. Okay.
we will come pick you up, bring you in, small snack before the session gets started, 3 one-hour sessions, lunch, and we will return you home. And it's a great, we've had a great response, because that is something that the hospital that occupied our building before us did very well. And we've had a great outpouring of those patients that were in that program, as far as, when are you guys going to be open with the outpatient again? I've even had a little lady at an independent living in the Cincinnati area call me herself. She gave me the list of folks that you know, is just ready and waiting for that programming to open again, because they truly felt that, or in her words, they were amongst friends and people with the same problems they had. So there was that feeling of camaraderie within those folks. So we are very excited. That should only be a couple more weeks out. So you know,
well, that sounds good.
We should reach out very shortly.
So my question again is, if a person first, do you go through an assessment, I'm sure you do, to identify what is outside of normative behavior?
Right.
And if it's drug related, from abuse of drugs, whether they be prescription or illegal drugs, or if it's something else going on. And again, the question that begs an answer is, do they ever get better?
It certainly can be most of the time managed, and they can have a very successful and a better quality of life than before they came in.
Okay.
Yes. And I like to think that mental health is kind of like tuning up a car.
Okay.
You know, as we all feel the benefit or the effects of aging. While something may work right now at this specific point in our life, as we age and as that disease process continues to take effect, We're going to need to come back in for that tune-up. Maybe 3 months, maybe 6 months. It is different for each person.
Okay.
Maybe something that worked very well for them for managing their depression or anxiety or, schizophrenia. Maybe something happened and they aren't taking their meds anymore. So now we're seeing that disease process and the exacerbation of that.
Okay.
Those are all reasons why we might want to have an assessment done or look at coming back in.
Are meds always a part of the treatment process?
Most of the time.
Okay.
Most of the time, yeah.
And what is exactly the impact of taking medications?
Oh, it's very important.
I really need to know that.
It truly is important. If your doctor, psychiatrist, whomever has put you or prescribed a medication for you, they must feel that that's the right med for you. If you feel that it is not, of course there's nothing wrong with getting a second opinion or letting, the key is great communication.
Okay.
Let the doc know, this, I don't feel right, this isn't good, this, I'm upset, or this is making me feel worse.
Okay.
But of course we all need to understand that most antidepressants, antipsychotics, they do take a little bit of time to reach a therapeutic level in the bloodstream.
Okay.
So it's important to listen to your doctor and follow his advice. But, if something just doesn't feel right, I truly encourage the patient to communicate that.
Okay.
So.
Well, I would have to say, just by observation, that most people have developed, that have these mental health challenges that I've observed, are not on medication,
Right.
and are trying to manage this the way they always have, which is, this is just me.
Right.
This is just me. I'll give you a case in point, and that is that I was at one friend's home, and her cabinets in the kitchen were not level. They were off. I mean, it's like, and it didn't faze them at all. And so I'm not going to be one to make this is your house. If you like your cabinets lopsided and hanging in odd positions and you're comfortable with your dishes sliding that way, then who am I to say? But I was concerned at that point, and when I brought it to their attention, kindly, they basically said, there's nothing wrong with these cabinets. And at that point, I said, either there's something wrong with me, or there's something wrong with them. And I don't know if, and I know I'm not the only person that has had these, I could go on and on and on, but as they're aging, it's my concern that who identifies, you can present a very normal front with your doctor.
Certainly.
These are coping skills that they have mastered.
That is definitely what it is. It's a cover. They're coping skills. That's why it truly does take a true professional to sit down and ask the questions, see if those folks meet criteria. And sometimes, even when we're under a doctor's care, unless that doctor specializes in mental health,
really,
most docs do not feel comfortable ordering medications that truly are the most helpful for mental health disease processes and diagnoses. It's just like we would not go to a psychiatrist to treat diabetes.
Right.
We should not go to a medical doctor for treatment
of
mental mind.
Okay.
Right. So I think it is important to treat both, identify and treat both of those illnesses. But the funny thing is, mental illness can affect the body and bring chronic illness, as far as if our mental illness does not allow us to take our medication or to exercise or to eat healthy, maybe we've just kind of checked out of life for a while because of what's going on here.
you know, it does affect our overall health. You know, it's
I would
kind of
have
like
to
a
believe
domino
so.
effect.
Yeah.
So, you know, if this isn't right, this isn't going to be right. So, you know, that's the reason we see a lot of folks in homeless shelters
Goodness
or
gracious.
sicker than what they truly need to be if we would just reach out and help this.
Right,
Yeah.
right.
Yeah.
This is so good what you're sharing. I just know that I have seen an increasing number of people, because I interface with so many people, that seem to be in a coping mode, which is they're always cheerful when you talk to them, but something is not right.
Right.
And maybe that's something that as humans, we pick that up.
Right.
That's just something, and it just seems to be a lot of older people.
Right. Well, and that's what it takes. It takes that friend or that loved one or whoever it is that is noticing that, because 9 times out of 10, it's not going to be the patient that makes that phone call to get themselves the help.
Really?
It's not going to be.
Because they do not have the ability to see it?
Because to them, there's nothing wrong with them a lot of times.
Whew.
So I would say that's 90% of our referral source.
Okay, it's from
it's
friends
that family,
and okay.
it's that friend, it's that person who's really noticed that Mr. Smith just isn't who he used to be. Things are going on with him. He's not. Maybe he's not coming to group or the adult daycare. Maybe when he gets to adult daycare, he's saying things that are inappropriate or no filter now, no inhibitions. You know, we've even had folks that, you know, unfortunately, I've seen a lot of situations, and I know when I worked up in the Cleveland area, you know, one time it was a brother calling because the brother, the patient had a lifelong history of schizophrenia, and when mom died, which was where the brother lived, he just kind of fell apart. And while they were all trying to manage him, he was living in deplorable conditions, basically.
Can you give my viewers just the clarity, because that's a term. What is schizophrenia?
Schizophrenia is, of course, a disease where affecting the mind, where they're no longer able to make good, sound decisions. It can be, you can live a successful, productive life as a schizophrenic on the right medicine.
Okay.
So it is something, as we talked on before, if it is managed successfully with meds and they adhere to their medication regime, people function very well.
How do you make them do their meds?
Well,
'Cause I
hopefully
keep running
they've
into those
recognized
situations.
that they have an issue and have an illness and need help with that.
Okay.
And this med helps them maintain.
Okay.
Yeah.
Are they able to maintain jobs and be in the workplace as well?
Yes.
Okay.
Yes. There are people we work with probably every day that may have mild schizophrenia, schizoaffective disorder, that are maintained on their medication.
And they continue to live fairly normal lives.
Yes.
Okay.
I guess that's the important thing or takeaway from maybe our meeting. If people have help or if folks can identify and get the word out that there are places like Blueridge VISTA that can help folks with their mental health and their mental illness, they can have a great quality of life and much better than what they're living right now. It's just getting that word out. So
Let's talk about hoarding.
okay.
Is hoarding a form of mental illness?
Certainly.
Why do
Certainly.
people hoard?
I really don't know why, other than it is a disorder that happens. I've seen it in assisted livings.
My
I've seen
goodness
it
gracious,
in
are you
private
serious?
residences.
Okay.
Of 25 years in nursing, I have cleaned many apartments and rooms, and you know, sometimes things happen before you even realize it. One particular resident I had in my building at one point, there was nothing more than a pathway to her bed and a pathway to the restroom.
Period.
Right.
What about the kitchen?
It was wall to ceiling newspapers, bleach jugs, milk jugs, anything, anything. Kitchen, in that setting, they went down for meals. So, yes, and I've...
And no one intervened, and this sounds like an assisted living environment, so...
Well, that's exactly what happened. It became a fire safety issue.
Yeah.
Yes, and so we had to, you know, with the family's help, that's another topic I do want to approach.
Okay.
If you have a loved one or have shared in the care,
okay,
and perhaps this is a discussion that needs to happen when we're making, you know, I say futuristic plans, but we never know what tomorrow's going to bring. So I would encourage anybody who shares in the care of a loved one to not only have a living will made, but to make sure that that patient or that person has a durable power of health care. So those are two very important documents, especially if those folks have a mental illness or if they have a diagnosis of dementia of some sort. Because we almost are guaranteed at some point, very soon down the road, they're going to need someone to make those decisions for them.
Yeah.
And without those documents, without that durable power of attorney of health care or guardianship, legal guardianship, that patient is not, they can make that decision on their own to not receive the help or to receive the help. And 9 times out of 10, they think nothing's wrong with them, so they don't need any help. So thus you have this cycle.
Absolutely. In some ways, it's akin to people that are entering into early stages of Alzheimer.
Oh, it definitely is.
You're like, what?
Alzheimer's is a type of dementia.
Okay.
And while we don't cure Alzheimer's or dementia, our hospital certainly can help manage the behaviors that come along with that.
Okay.
So that's where
important. I mean, no, really. Alzheimer is, and for those of you that aren't aware, because I've talked about this with guests over the years, Alzheimer is epidemic. And once you run into Alzheimer, it's unforgettable. Once you have a family member or an associate and you see the behaviors, you will know and recognize. But with this baby boomer boom, the numbers of people that are expected to manifest that disease are catastrophic. So listen in attentively, because this is good information. So you all do have the capacity to intervene.
Well, with those behaviors.
Okay.
We don't profess to be able to cure
Alzheimer's
or dementia.
No, a dying brain is a dying brain. I pray that we have adequate research. I mean, they're continuing, but it's just like a huge tidal wave coming.
It is.
And,
it is.
And I just, it just is so sorrowful.
It is, but that's thus even more reason to spread the word about how we can help. Keep mom or dad at home, help them become, you know, offer them a better quality of life by helping get, you know, some help with those behaviors that maybe are preventing them from, you know, living a better life.
Right.
So
because
many
the behaviors are just, oh my God.
Yes.
I mean, really.
Yes, yes. Just, yeah, and that's probably our average patient is that 75-year-old female with Alzheimer's dementia with behaviors.
My gosh.
Yes.
With behaviors.
Yes, yes.
And you're able to see, can they go through counseling?
They're very much able, and it depends on what phase in the disease process they're in.
Got it, okay.
But if they're able to engage in that therapy that we offer, which a lot of folks are, you
Okay.
know, yes, they can benefit from coming in. And with that little bit of med adjusting and that therapy, it's remarkable. So
That is very good information to know. So in a situation like that, would the spouse or the caregiver of that person contact your company?
they can contact Blueridge VISTA, or they can contact me directly.
Okay,
I would
and I'll
love to
give that
come out,
yes.
meet with the family, have that discussion, make sure that family member, as well as the patient, if they're, you know, there's that period where patients have lucid moments, and it's got to be very scary because they know something's not quite right. They just
Do they know?
Sometimes.
They do, that things are a little bit off?
Yes, sometimes. In early stages where they
Okay.
still have, they're still very cognitively aware at
Okay.
times.
Okay.
And that's that unfortunate period. And sometimes that's not, you know, they're in denial at that point.
Okay.
They haven't worked through those phases yet.
Well, that would be, I mean, I had a friend that died from complications from Alzheimer, because you don't die from Alzheimer, but
Right.
Alzheimer, the brain forgets to tell the heart to beat.
Right.
And
we
they go into
we
a-
forget how to eat,
Yeah.
we forget how to walk, we forget how to do all of those things that all of us take for granted
Right.
every day.
But she shared with me, she said, if you see me acting differently and you think it's Alzheimer, she said, I hope you will tell me. And I wanted to tell her, and if I tell you, you'll forget. You'll forget, I told you. But she was a beautiful woman in her day, but that disease destroyed her. And
I can't
just
even
destroyed
begin
her.
to tell you the wonderful people and beautiful families that are affected. Just innumerous. Yeah.
So the question that everybody wants to know is, how do I pay for this?
Well, we accept all insurances.
Okay.
Except straight Medicaid, because
Okay.
we're freestanding.
Okay.
We're not fortunate enough to be recognized as one of those facilities that is Medicaid reimbursable.
Okay, well.
So, but we'd like to think we can help with everything else.
Okay.
The only patient that we truly can't help is someone on dialysis.
Oh.
Because insurance feels as though, you know, if they need to leave our facility 3 times a week
that's
for
impossible.
hours at a, you know,
Yeah,
3 or
that's
4
hard.
hours at a time, exactly how much of a benefit are they getting with
Right,
an inpatient stay?
right.
But that's certainly a patient we can look at for the outpatient program.
Okay.
So there is a way somehow we can help.
But again, I guess from what I'm hearing, someone has to take the initiative if it's not going to be the patient
Right.
or potential patient.
Right.
Someone still has to take the initiative to recognize that this is a situation that does not have a comfortable resolution.
Right.
That you are going to have to intervene.
Right. And sometimes it's regarding their own safety. You know, maybe, you know, as Alzheimer's or sometimes some types of dementia progress, you know, there is that sundowning where, you know, normally toward the end of the day, we all kind of run down. Well, and an Alzheimer's patient or a demented patient, sometimes at 5 and 6 at night, they're ramping
up. Yep.
And maybe they're not going to go to sleep for a couple days. So there's that concern, and that's one of the highest. You know, we have that stressor for that caregiver that is
well,
just
the person
they're
is
worn
up
down.
for 3 days.
They're worn down.
Yeah.
So, you know, I can't encourage folks enough. Please call us. We want to help you. We want to offer that. You know, there is light at the end of the tunnel. We can help you maybe manage mom or dad longer at home, or maybe it's time to look into long-term care placement. We are able to help you do any one of those things.
So you do
know,
assist if that situation
certainly
is deteriorating to a place where you cannot safely
Right.
keep them in a home, because it's going to come to that.
The good-
I wish it were not, but I have not
Right.
seen people do the best they can, but at some point it's just completely
Too
and
much.
totally too much.
Right. And whether that has gotten to that point or not, you know, the good thing about Blueridge is that when the patient comes in, that at first day of admission, we're looking for and working toward a discharge plan from the moment they come in.
Okay.
What's going to be the safest for Mr. Smith or Mrs. Smith once she discharges home, or he? You know, family's adamant about keeping her home, and we've all talked, and we feel that it's going to be safe as long as there's home health in the home.
Okay.
Maybe the neighbor's going to come in and they're going to take turns sitting at night.
Okay.
Maybe, you know, the family has other resources that initially they didn't think was going to pan out, but now, you know, we've got that patient covered safely.
Okay.
You know, that's not to say they can't go back home, but maybe it's just time to look at long-term care or other options. So, you know, that's something we can help with as well, is placement. You know, what's going to fit best for that patient.
Okay.
So those are all things we help with. We even help other facilities. If we've gotten a call from a skilled nursing facility that they went out, they assessed the patient, they thought, you know, Joe Smith was going to fit well into their milieu, and come to find out he's been there, he's gotten through that adjustment phase, but he's just not a good fit. You know, we don't have a locked unit. He's tried to get out of the building several times. He's striking out at other folks. You know, these weren't behaviors that presented at the time of that initial assessment. So now, over the course of a new environment, lots of change, these are all coming to surface. So those are other things that we can help with.
That is absolutely wonderful.
Yes, we'd like to
I mean
think
that. I really do mean that. Have you all developed tentacles with these different targeted associations like Alzheimer?
We have.
Okay.
We've reached out. When I worked in Dayton, we worked, you know, we were a resource for the Dayton chapter.
Yeah, I'm very familiar with them.
Now, as well as in Cincinnati.
Okay.
We work very closely with all the counties with their APS.
Yes.
Those are big referral sources.
Okay.
Those folks usually, they're the ones that are called when there's a problem in the home. And normally it's mental health. It's a mental illness that is the reason they're being called out to begin with. We work very closely with the police departments.
Do you?
Those are also great referral sources.
Because they would be involved in intervention?
Intervention, they respond to calls. Maybe an 80-year-old little grandma is hearing people looking, or hearing people outside her window at night, or she's paranoid, so she's delusional at thinking people are out to get her.
Okay.
And they have the house surrounded. You know, those are the types of calls that we can help with.
Okay. That is extremely good information. I got involved with APS, also known as Adult Protective Service.
Correct.
Oh, almost 20-something years ago. There was a triage, and it was just beginning to emerge as an issue. And I was involved from the financial part because of my involvement with families and these people and money, because a lot of this was stemming around money.
Yeah.
And the families wanted to deal with it because grandma was writing checks to everybody.
Right.
And had accepted a person to move in.
Right.
Didn't know him from Adam's house cat, but now you got this person in the house. Excuse me, if you could zoom in on me. I want to emphasize that for everyone watching this show, please keep an eye on the elderly in your family.
Yes.
Especially and particularly if they're over the age of 80, because there is a fragility that comes with aging. And it's all age driven. And believe me, if they're alone, that's not a good situation. I don't care how independent they are. Things just simply change as people grow older. Is that a fair statement?
It's a fair statement, and there are some mean people out there.
Oh my God.
And they will take advantage of
Yes,
folks.
they will.
And I think it's our duty to help and to help our older folks and make sure they have the care and the resources and they're protected.
Right. I
So-
think of old people and children in the
Yes.
same venue because they are precious and they're innocent.
I agree.
And but this is not an innocent place.
No, it's not.
It is
No,
not,
it's not.
particularly if people are perceived to have challenges.
Right.
There are people that are more than willing to take advantage of that challenge
That's true.
and cause abuse. Do you find that mental illness runs in families?
I agree with that.
Okay.
Yes. Yes.
So it's not just one or two, it's
No.
a whole family.
It can be.
Mhm.
And then you can have perfectly healthy mental health, your husband, and have a child with schizophrenia. You know, it happens.
Okay,
I've seen it.
okay.
So it's just how it
It's
happens.
just how it
Yeah,
happens.
yeah.
But it is fair to say that there is a venue available today to deal with people who are struggling, even
Oh.
if they don't perceive that they're struggling.
Yes.
But it's got to be a struggle when you are not hitting all cylinders.
Correct. Correct.
And one of the things that I have observed, just an observation because I'm a lay person, is that in many cases, they get stuck on something and they can't move beyond it, a certain behavior.
Fixated. We like
Is
to
that
say.
what that's called?
Yes.
Okay, would you speak on that?
Well, when folks become fixated, and that truly is something that is important information to share with someone doing an assessment.
Okay.
They perseverate or they fixate on something and they just can't seem to move past it.
Okay.
That is something that would indicate to a clinical professional that there's a problem here.
Okay.
So
Can
yeah,
life events trigger?
certainly grief,
Like death,
death,
grief? Okay.
most definitely, yes. Just day to day, and
Okay.
that person that's mentally ill they can become fixated on something. You know, maybe in long-term care, it's somebody who, you know, it kind of sets the stage for that whole day, and they can't move past it. Maybe
Okay.
somebody walked into their room that they weren't welcomed, or
Okay.
and they just can't let that go, and it kind of erupts into this behavior. So yes, yes,
Yes, I've observed that. That's
Yes.
why I just asked about the inability to move beyond a certain event
right,
or situation,
right,
and including family.
true.
Okay, including family, which is it's just an inability to move beyond that. But I will tell you, early on in my practice, I used to do home visits to seniors who were contemplating getting involved with reverse mortgages. That goes back almost 25 years. And I stopped doing home visits because I could not believe some of the things that I was encountering.
Oh my, yes.
And that's why I asked you about hoarding. There was a woman who had a 3-story home, and on every floor, including the basement, she had tons and tons of Christmas stuff, including trees. She had covered the windows so that nobody could see in because she said people are peeping in. And I was like, not on the 3rd floor. And
She wasn't able to process
she wasn't,
that.
and when
Yeah.
I shared with her, we can't do anything until the appraiser has to come in here, and he's not coming in.
Yeah,
because we couldn't get past the door
Right.
for the trees and things. Now, is that something, and her son lived in Dallas, very wealthy son.
I know.
Now, this is the truth, a very wealthy son. And when I contacted him about his mother's state, he took great offense.
Right.
And said to me, my wife has that issue. There's nothing wrong with my mother. And I said, well, I'm not prepared because I'm not a professional. I said, but I can't get into the home.
Right.
To do what I need to do, and if you're willing to get the home cleaned out, and I was like, that's before hoarder television and all that. I said, if you're willing to get the home cleaned out, we can do something. Fast forward today, I could have called him and suggested to him to contact you for an assessment.
I just came to Mom's home. This is what I found. These are some resources in the area if you're open to maybe getting Mom some help. You know, this is what they do. They're specialists in this area, in this field. Yeah.
So people should not take a dim view about this at all. This is manageable.
And here's the thing, Michelle. A lot of people who govern their loved ones' estates or their
guardians.
Yes. They do live out of state. They don't have that bird's eye view or hands-on view of what the actual picture really is. They're relying on, you know, well, I call my mom every Sunday. She's fine. We talk about da-da-da-da-da, and there's no indication that anything's any different. Well, that's not how she's living. So we encounter this all the time.
Do you?
We do.
That's good to know.
In admission, I worked just last night. The healthcare power of attorney was in Florida. So,
that's
and this
great.
is for somebody in Hamilton.
Okay.
So you have that a lot. You know, life happens to people. They move out of state, you know, for whatever reason. But it's important to be an active. If you're assuming that role for someone, it's important you communicate with the people providing the care, people, maybe a neighbor who can keep an eye on and give you an accurate
feedback.
report. You know, all of those things. If nothing else, for safety reasons.
Right.
You know.
Right. We're running out of time.
Oh my!
I know. Give them your phone number.
My direct contact is 513-292-4378. Blueridge VISTA Health and Wellness. We're located at 5500 Verulam Avenue in Cincinnati. Our number to the hospital is 513-841-3001.
So they can actually ask for you, Ms. Bass?
They certainly can.
Well, that is a comfort to know. And as always, we've zipped through this hour. We're officially done. The interview can go on, but you've got enough key information, and certainly I do, to govern how you deal with these situations in your family, amongst your friends and your peers. It's a blessing that we now have companies that are committed to providing help. This is so they can live a normal life without the sorrows and the pain that they cause so many of us around them, because we don't know what to do. We do not. But this has been an awesome interview. I have so enjoyed learning. And again, the focus of the Power of Money is going to be also including health and wellness for people, because that's what's up, as the kids say. Again, I appreciate your viewing this show. You can always watch archive segments via YouTube, The Power of Money, Michelle Graves, and see some of our earlier shows, lots of them in fact. And again, it's all about getting an understanding to help you and your family in the difficult days that we're in. I'm your host. Always a pleasure to be a part of your world. And in closing, I wish you peace, love, and also joy. You take care and you be blessed. Take care. Bye-bye.